Hi, I'm Janice Johnson, and I'm going to present an introduction to behavior therapy based on Chapter 11 of our text, Counseling and Psychotherapy, A Christian Perspective. Behavior therapy had its roots in the application of learning theory to the treatment of clinical problems. Current behavior therapy combines modern learning principles with findings from scientific psychology to treat specific behavioral disorders. Behavior therapists tend to view human beings as being the products of their environments and the products of their unique learning histories. Now, there are many individuals that contributed to the development of behavior therapy. Joseph Wolpe in the late 1950s through the 1990s was essential in the establishment of counter-conditioning processes and procedures. B.F. Skinner, who our author Tan describes as one of the most influential psychologists of the 20th century, contributed concepts of operant conditioning, contingency management, and also the idea that human beings don't really have freedom of choice or free will, which in fact influenced behavior therapy. Donald Meachenbaum contributed concepts of cognitive behavior modification and self-talk. Arnold Lazarus contributed concepts of multimodal behavior therapy, and Albert Bandura contributed concepts of social learning theory and self-efficacy theory, all of which we'll talk about. Behavior therapy is generally spoken of as having come about in three phases. The first wave in the 1950s, 1960s, and 1970s was based on the work of Wolpe and Skinner and was based on counter-conditioning, contingency management, and operant conditioning theories that they proposed. Now, behavior therapists of this period had a deterministic view of human behavior, human nature, believing that, as we mentioned, humans really didn't have a freedom of choice, so that their behavior was the result of environmental events that occurred. And also, human nature was considered to be neutral, neither positive nor negative. Now, the second wave came about in the 1970s, and this was a broader-based cognitive therapy that incorporates the thinking dimension of humans into the therapy, in addition to the environmental factors that the first wave considered. This is really the predominant approach in use today. The third wave came about in the 1990s, and it includes an expanded emphasis on mindfulness and acceptance, which really is focusing attention on an individual's immediate experience in the present with acceptance and not judgment or evaluative attitudes. The second and third waves of behavior therapy both ascribed a measure of freedom of choice, self-reflection, and self-control to humans. Now, there are four major feature developments or principles in behavior therapy. Classical conditioning or respondent conditioning refers to the way in which current behavior is controlled by antecedents. So an event occurs or a stimulus occurs, and that causes a behavior to occur. In classical conditioning, two stimuli are linked together to produce a newly learned response. So this is really the classical Pavlov dog illustration. So food is an unconditioned stimulus to a dog, which always evokes a salivation response, which is an unconditioned response. A bell is no stimulus to a dog, and it evokes no response. But if the food and bell are presented together, because the food is being presented, the salivation response occurs. And if the food and bell continue to be presented together, the bell becomes a conditioned stimulus that evokes a conditioned response of salivation from the dog. But the important point is that if the bell continues to be issued alone as a conditioned stimulus, eventually the conditioned response will fade away. And this fact forms the basis for Wolpe's systematic desensitization theories that he proposed. Now, operant conditioning involves learning processes in which behavior is controlled by consequences that follow that behavior. This is based on the work of B.F. Skinner. So if you want to reinforce a behavior, if a pleasant or rewarding consequence follows that behavior, that is a positive reinforcement, and that behavior is likely to be increased or maintained. Also, if you have a negative or adverse consequence that you eliminate that follows a behavior, that's a negative reinforcement, and again, the behavior is likely to be increased or maintained. If, however, you have a punishment situation where a negative or adverse consequence follows a behavior, and that is negative or adverse, that behavior is likely to be decreased or eliminated. So reinforcement techniques would be used to increase a desired behavior, punishment techniques would be used to decrease an undesired behavior. Social learning theory was brought about by Bandura, and this pays much more attention to processes such as observational learning and modeling. And as a result, modern behavior therapy has incorporated much more of a focus on cognitions, perceptions, and self-efficacy expectations. So how an individual interprets life events, not just the tangible events themselves, are viewed now as a crucial determinant of behavior. All of these are considered to affect an individual's emotions and behavior. Cognitive behavior therapy is really the predominant contemporary behavior therapy. It recognizes and endorses the idea that self-talk, attitudes, expectations, beliefs, values, thoughts, and mental processes influence feelings and behavior. And all of those things, that self-talk, those attitudes, those expectations, beliefs, and values, mediate the relationship between the antecedent event or the stimulus event and the behavior. So an event occurs in the environment that elicits a behavior, but in between, there's cognitive processes, there's thinking, there's expectations, there's attitudes that moderate and modify how the client is going to react to that stimulus. So techniques to modify false or irrational thinking that cause those undesired behaviors and bring about change in the individual, that is what cognitive behavior therapy does. Now, psychopathology was defined by Volpe as being a neurosis or a maladaptive behavior that's acquired over time through an individual's particular learning history. Maladaptive behavior is often used to reduce an individual's anxiety. So when an anxiety-producing event occurs, often the behavior that's used to address that is an undesirable maladaptive behavior. These behaviors are acquired through conditioning and can thereby be unlearned and replaced with conditioning for desired behaviors. So maladaptive behaviors are influenced by cognitive processes. So negative, irrational, extreme, unreasonable, and illogical thinking that results in maladaptive behaviors and emotions can be modified by observational learning and modeling and can be used to bring about more appropriate behavior through conditioning of the desired behaviors. Now, talking for a moment about the therapeutic process and relationship. In behavior therapy, the behavior therapist is actively engaged in conducting the therapy. The behavior therapist shows genuine concern and respect for the client, and the therapeutic relationship is expected to be warm, empathetic, genuine, and collaborative, as it is in other relationships. In behavior therapy, the behavior therapists do not view the therapeutic relationship alone to be sufficient to bring about change in the life of the individual. So importantly, in behavior therapy, specific therapeutic interventions have been found to be more significant to change than the therapeutic relationship. So in the world of behavior therapy, the therapeutic relationship is important, but takes a second seat to the specific therapeutic interventions that are used. Behavior therapy focuses on solving problems and overcoming issues that are presented by the client. And as such, behavior therapy focuses on specific techniques that have been empirically proven to be effective for a wide range of psychological disorders. And these are often grouped into categories. Operant conditioning techniques we've spoken about a little bit. Negative and positive reinforcement is used to reinforce desired behaviors. So adding a positive consequence to a behavior will cause that behavior to be reinforced, or removing a negative consequence will cause that behavior to be reinforced. Positive and negative punishments are used to eliminate an undesired behavior. So if you remove if you implement a punishment following a behavior, that will weaken an undesired behavior. Or if you remove a positive experience following a behavior, that's negative punishment, and that also will weaken an undesired behavior. Now, extinction is very similar to negative and positive reinforcement in that it's used to eliminate a behavior that has already been reinforced in the past. So it removes reinforcement of a targeted behavior that has been reinforced by circumstances from the past. What's important here is that both punishment and extinction techniques have been found to have, upon occasion, some negative consequences of causing anger or aggression in a client. So these have to be used very carefully by trained therapists, and most often they will only be used when necessary, or really most often it'll be positive or negative reinforcement techniques that are chosen. Now, behavioral activation is a technique that's based primarily on healthy behaviors that we want to be reinforcing in clients that are depressed. So this is used primarily with depressed clients. Token economies, probably many of us are familiar with. This is where tokens are given to a client when they perform a desired behavior, and those tokens can be accumulated. They can also be lost when a client performs an undesired behavior, and then those tokens can be exchanged for the receipt of privileges. So perhaps some of us have experienced those in a variety of circumstances. Social skills and assertiveness training is a behavioral intervention that's used for clients with interpersonal difficulties or deficits in social skills interactions with others. The behavior therapist coaches the client and teaches the client how to interact more effectively and appropriately with others. Anger management training is provided for clients who have difficulty controlling their tempers or have aggressive behavior, and this therapy can also be used in conjunction with social skills training. Assertiveness training is a specific type of social skills training that's used to help clients who have difficulty expressing themselves freely, have difficulty saying no or asking requests of others, or even stating positive or negative comments. Clients are taught to differentiate between passive, aggressive, and appropriately assertive behaviors. Modeling is a set of techniques that is used to help a client through observing another individual modeling behavior. Teaching is a client learning a new behavior by observing a model. Prompting is reminding or cueing a client to perform a behavior once they've seen a model perform it. Motivating occurs when a client sees a model receive positive consequences for performing a particular desired behavior, and thus they're motivated to want to perform that as well. Reducing anxiety occurs when a client sees a model perform a behavior without any negative consequences and without anxiety, and that then helps the client to reduce his or her own anxiety. Discouraging occurs when a client observes a model perform behavior and receive negative consequences, and that then discourages the client from wanting to perform that behavior. So that would be a way of eliminating an undesired behavior. Modeling can occur in several different ways, and it can occur from an individual watching a model perform a behavior live. It can be performed through symbolic modeling, through reading and watching videos. It can be performed by the client imagining in their mind successfully performing a behavior for which they have anxiety. Role-playing occurs when the therapist and the client both interact and play a role in performing a behavior that the client is desiring to address, and take turns with the role. And participant modeling occurs when the client gradually becomes a participant in the behavior that's being modeled. Systematic desensitization is a core behavior therapy, and it occurs through pairing an anxiety stimulus with what's called a competing response. So something that causes anxiety is paired with something like a relaxation technique, or imagining a wonderful place, or using humor or laughter to address those feelings of anxiety. So the client learns the competing response. The client visualizes the activity while performing that response, so visualizes the anxiety situation while performing a relaxation technique, and over time the anxiety response is reduced to zero, and this importantly occurs through repeated exposure to that particular anxiety. So that is a key to this therapy. This has been used to treat anxiety and phobia disorders, as well as anger, insomnia, asthma, nightmares, and other sorts of things. Relaxation training is a therapeutic technique to use to assist clients, again, with a wide range of issues, phobias, anxieties. But it can cause some issues with clients, so it has to be tailored carefully to each client. Progressive muscle relaxation helps the client learn to relax by progressively relaxing muscles. Stress inoculation training uses slow, deep breathing, calming self-talk, and pleasant imagery to address anxiety. And the relaxation response is sitting quietly in a room, relaxing your muscles, breathing through the nose, saying a particular word, keyword like peace, and then maintaining a positive attitude for a period of time. Flooding and in vivo exposure is an exposure therapy that's used to treat clients, again, with phobias or anxiety disorders. It's similar to systematic desensitization in that the client is exposed to stimuli that provoke the anxiety or phobia. However, in this therapy, the client is exposed at a maximum anxiety level right from the start of the therapy to help that client begin to deal with that anxiety response. Flooding in vivo occurs when the flooding is occurring in real life in a particular place. And if that client is unable to leave that situation, like it's occurring in a room and the client can't leave, that's called in vivo with response prevention. Flooding can also be done through imaginal flooding, where the client imagines the anxiety response at a high level in their minds and begins to deal with it. This flooding and exposure can also occur through the use of virtual reality techniques. They're available currently. This therapy has been used to treat a wide variety of anxiety-related issues such as agoraphobia, obsessive-compulsive disorders, fear of flying, fear of public speaking, fear of enclosed spaces, and even fear of medical procedures. Eye movement desensitization reprocessing is linked to flooding in that it pairs imaginal flooding with rapid rhythmic eye movement. This technique has been proven to be successful. However, it's still controversial because it's not known if the imaginal flooding piece, which is known to work, if that's the piece that's working, or if the rapid rhythmic eye movement actually contributes to the solution of the problem as well. So it is somewhat of a controversial technique. Self-modification programs and self-directed behavior is an important part of behavior therapy because it empowers clients to choose the goals and the behaviors they want to modify, as well as the techniques they want to use to do that. They do receive guidance from the therapist, picking goals and behaviors perhaps together or with guidance, choosing the techniques together, and then monitoring and modifying the plan if it's necessary. This has been used to treat depression, panic attacks, fear of the dark, as well as health problems such as asthma, diabetes, headaches, and substance abuse. Multimodal therapy is a comprehensive and systematic approach to therapy that uses many cognitive and behavioral therapy techniques to treat a broad range of clinical problems. Multimodal therapists function as coaches, consultants, educators, trainers, and role models, and they provide instruction, suggestion, constructive feedback, positive reinforcement, verbal praise, and some amount of appropriate self-disclosure to help the client with their issues. This therapy views the client as being the product of 7 important domains: behavior, affect or emotions, sensation or physiological symptoms, imagery, cognition, interpersonal relationships, drugs, and biological functions. Multimodal therapists believe that the most effective therapy should be comprehensive in addressing as many of these modalities or domains as possible with as many different therapies as possible to deal with the issues presented as well as prevent relapse, although these domains can be considered separately and independently as well. Mindfulness and acceptance-based cognitive behavior therapy is a third way of behavior therapy technique. It is based on therapies that emphasize mindfulness or focusing attention on an individual's immediate experience in the present with acceptance and not judgmental or evaluative attitudes. Dialectical behavior therapy is used to treat borderline personality disorder through regulating emotions and tolerating stress, and it's based on training in mindfulness that's based on Zen practices. Mindfulness-based stress reduction is a group intervention that can take from 8 to 10 weeks, and clients are taught meditation and mindful yoga type of practices in which they practice daily. Mindfulness-based cognitive therapy is used to treat depression, especially reoccurring depression, through mindfulness training as well as cognitive behavior therapy. And acceptance and commitment therapy is used to help clients accept painful experiences or memories from the past without trying to fight them or change them or control those unpleasant feelings. Cognitive behavior modification includes both behavioral coping skills such as relaxation techniques and strategies such as coping self-talk or instructional training. Stress inoculation training is a subset of that, a variety of that, in which cognitive behavior modification therapy brings about education, skills acquisition, and then the use of those skills to overcome the issues that are presented. And again, this has been used to treat a wide variety of medical issues, traumatic events, chronic pain, and even occupational challenges. Behavior therapy has a number of strengths and weaknesses, many of which we've covered so far. It is a versatile and comprehensive approach to therapy that applies to many diverse individuals. Children, adolescents, adults, even adults with schizophrenia can be treated with behavior therapy interventions. It is also used in many different settings and is relatively short term. It emphasizes the client's choice in setting goals for therapy, and it uses empirically supported interventions to do so, interventions that have been proven to be effective for moderating client behavior. It addresses a client's current environment rather than focusing too overly much on the past. There are therapies that focus on the past, but behavior therapy is not one of them. Behavior therapy and behavioral therapists are open to the use of psychiatric medications for severe psychological disorders such as bipolar disorder and schizophrenia. Not all therapies are accepting of that. It contains a wide array of therapeutic interventions and techniques that have been proven effective. It is the most empirically supported approach available currently to therapy. It is easily adapted to clients from other cultures, from different cultures and backgrounds, because the client is empowered to choose which interventions and techniques they feel most comfortable with, that fit most comfortably with their culture, and also the particular behaviors they're going to attempt to solve. It is a problem-solving approach to therapy that is relatively short-term. There are some weaknesses, however. Behavior therapy treats symptoms and problems, not the individual holistically, which some other therapies do attempt to do. It emphasizes techniques more than the therapeutic relationship because the techniques are viewed as being what solves the problems. So this can be a deficit with the therapeutic relationship taking a second seat. It doesn't adequately focus on past unresolved issues from the past, things that somehow even currently affect behavior and sometimes need to be resolved in order for the behavior to be solved. It tends to ignore transference and dreams, transference being transference of anger or emotions, and the content of dreams, which may have meaning to what's going on in the client's thinking. It does not deal with existential issues, the meaning of life, why I'm here, the existence of God, and those sort of things, which many clients, really all clients, do need to address and deal with. There is the danger of the therapist acting like an expert and influence the client with the therapist's own values, because the therapist is directing the therapy and helping the client with overcoming their issues. And so there is this danger of the therapist imposing their own values on the client, which is not to be desired. The techniques of behavior therapy can be simplistic, which we've discussed some of those, so they can be easily misused and abused by inadequately trained therapists. So adequate training is essential for behavior therapy techniques. It isn't always sensitive enough to address the larger socio-political context, such as racism or political unrest. And it's not always sensitive enough to address the impact of others around the client in circumstances where the client may become more aggressive or assertive, or their behavior may change. It does focus on the client. Now, from a biblical perspective, in its earliest iterations, behavior therapy tended to reduce all behavior to a simple stimulus and response relationship and really contained very little recognition, if any, of human will, of transcendence, or supernatural. But we do know that the Bible clearly states that God created human beings with the gift of free will and choice. It was free will and choice that enabled Adam and Eve in the second chapter of Genesis to choose to disobey God and enter into sin. Deuteronomy 30:19 says that the people are instructed to choose life to make that choice that both you and your descendants may live. In Psalm 119:30, the psalmist declares, I have chosen the way of truth. So clearly, the Bible endorses the concept that God created human beings with the gift of free will. The Bible also affirms the reality of God, declaring in Hebrews 3:4 that it is He who built all things is God, as well as the spirituality of human beings, declaring in Proverbs 20:27, the spirit of a person is the lamp of the Lord. So free will, transcendence, and supernatural is an important part for Christian counseling. Importantly, however, recent iterations of behavioral therapy have recognized the free will of human beings to some extent, and also have attempted to introduce religious, spiritual, and transcendent topics. Secondly, behavior therapy emphasizes the effect that the environment has on individuals and the reinforcing conditioning have on human behavior. And Tan notes that this corresponds to the biblical concept of rewards and incentives. Now, the biblical concept of rewards and incentives is really more eternal and transcendent than what behavior therapy would be. But certainly the law of sowing and reaping described in Galatians 6:7 corresponds to the concept of rewards and incentives. Romans 8:18, Paul declares, for I consider that the sufferings of this present time are not worthy to be compared with the glory which shall be revealed in us. So that glory is an eternal reward that has impact on behavior. Jeremiah 10:23 likewise states, it is not within an individual to direct their own steps. So as Christians, we know that we need God's help with our choices and with our living. As well. Tan states that behavior therapists have correctly reminded us of our limited freedom to choose. God has unlimited freedom, but ours is based on certain restrictions. Behavior therapists enable clients to choose their own goals based on their own values. And although this is good from a therapy perspective, from a biblical perspective, values must come from God and His Word alone. So when selecting and choosing behavioral interventions, it's important that those interventions that are selected and the goals that are being worked on align correctly with God's Word, with the values that God's Word presents, and with biblical teachings. Now, behavior therapy has the potential for powerful behavioral change interventions to create change in clients, and as such, to develop a nearly sinful sense of self-sufficiency and a sense of over-dependence on self. I did this, I worked through this, and Philippians 4:13 clearly states that it is only through Christ and His strengthening that we can succeed. So it's very important from a Christian and biblical perspective that we work with clients to help them understand we need Christ, we need His strength, we need His Spirit within to help us adapt real effective change. Behavioral therapy does not place as much emphasis on the therapeutic relationship as some of the other therapeutic models do. And we know that Christianity is relationally based. Ecclesiastes 4:9 and 10 says, two are better than one, for if they fall, one will lift up his companion. So it's very important that from a Christian perspective that we emphasize the relational aspect of therapy. Behavioral therapy also is not strong enough in focusing on larger comprehensive life issues such as family, religious, cultural, and political influences on a client's life and circumstances. We know we live in families, communities, the body of Christ, and these must be considered in Christian-based counseling because they do impact the client's behavior, the client's choices, and they must be considered from a Christian-based perspective. Additionally, the body of Christ is an important aspect of Christian therapy and should provide a secure support system for clients that are struggling. Behavioral therapy is more focused on current symptoms and problems than on past influencing experiences. And from a biblical perspective, an individual's past painful memories, developmental issues, and the remaining consequences of past decisions is important to deal with. Behavior therapy does not pay much attention to the darker side of human nature that needs to sin and evil. And from a biblical perspective, we need to deal with the struggles and consequences of a sinful nature. Romans 3:23 declares, for all sin and fall short of the glory of God, and sin must be dealt with from a Christian perspective. We've also discussed exposure therapy. Tan notes that this corresponds, the restructuring of the mind from this approach corresponds to the renewal of the mind as expressed in Romans 12:2. And also, behavior therapy is significant for its emphasis on using techniques that are proven empirically effective. From a biblical perspective, techniques must be selected for their compatibility with biblical truth, morality, and ethics. And finally, toward the end of this chapter, Tan states, the ultimate goal of Christian therapy or counseling is more transcendent and eternal, centered in becoming more Christ-like. So that really is the ultimate goal of behavior therapy interventions and techniques, and that's really what we're working on as Christian counselors. So thank you very much for listening to me. God bless and thank you.